Regular physical activity is key to promoting good physical and mental health and preventing chronic diseases. In spite of this, 44% of Australians are not getting enough physical activity to benefit their health. Promoting physical activity and preventing chronic diseases of the population of our catchment is a key priority of our integrated health promotion plan. This aligns with our organisation's strategic priorities as well.
We have developed this video to support you to increase your levels of physical activity and reduce the amount of time you spend sedentary at work.
The National Physical Activity Guidelines recommend that Australian adults aged 18 to 65 should be performing at least 30 minutes of moderate exercise most, if not every day of the week. They also recommend strengthening exercise 2 days per week, and we want to encourage reducing your sitting time. However, doing any activity is better than doing nothing.
In the last week,
roughly 4 hours of physical activity.
And approximately 2 hours, which is really bad.
I went to the gym twice and they were 45-minute sessions.
Physical activity level would probably be at about a 2, which is really bad.
3 out of 5 stars, sorry.
So overall, I would rate my physical activity level at about a 3. There's days where I'm really good, but days where I'm definitely not getting enough physical activity.
So I'm going to run you through a 5-minute exercise routine to help you reduce your sitting time at work and help you to live a healthier lifestyle. The first exercise we're going to perform is one for the chest. So I want you to bring your arms back behind your body, reaching to the back of the chair, and slowly bring your chest forward. And I want you to hold for 20 seconds. The next exercise I'm going to get you to perform is slowly dropping your left ear to your left shoulder while keeping your shoulders down, and hold for 20 seconds. The next exercise is keeping your arms by your side. Slowly rotate your shoulders back, down, forward and up to create a shoulder roll, and complete this 10 times. The next exercise will be for the arms. So bring your right arm forward in front of the body, across the body, holding on at the elbow with your opposite arm. Hold for 20 seconds. The next exercise is sitting forward on your chair. Straighten one leg out in front of you and gently bend forward from your trunk until you feel a gentle stretch underneath the back of your leg, and hold for 20 seconds. So I'm going to get you to sit into your chair, stand up and then take a seat, and repeat this for 10 times. The next exercise is standing with your feet hip width apart, rising up onto your toes and back down, and repeat 10 times. The next exercise is a little bit challenging. If you don't mind showing off to your workmates, we're going to use the bench as our push-up station. So placing your hands on the desk, creating a plank position. I want you to lower your body into the table and then push yourself away for a decline push-up. Repeat this as many times as you can until you feel fatigued. So drop down and give me 20.
Hello, my name is Min and I'm a physiotherapist working for DPV Health. Many people come to see me with pain in their neck, back and shoulders, and oftentimes this is caused by prolonged sitting positions. Now, did you know that the average Australian sits for about 9 hours a day? And of those 9 hours, about 7 of those hours is usually spent at work, sitting.
I would spend around about 6 hours a day sitting.
I think I would spend approximately 5 to 6 hours sitting per day. Yeah, I would probably rate my posture about a 2.
Rate my body posture maybe 3 out of 5.
I would rate my body posture at around 3.
I often encourage people not to sit for too long. However, if you have to sit, there's a few things that you can do to help. One of the best things to do is adjust your chair, okay? And so there's usually about 2 or 3 levers on the chair. If you can adjust the height of your chair so that your hip and your knee angles are about 90 degrees, and that lever sometimes also controls the backrest as well. Again, I try to bring the backrest right up against you so it hugs your back. And if your backrest is good enough that it's got a lumbar support, again, if that sits in the small of your back. Now, if your chair doesn't have a lumbar support, you can use like a rolled up towel, or if you can't get a rolled up towel, use a jacket or jumper that you have. It just needs to sit in the small of the back. The other thing that's important is to ensure that you have your elbow about desk height, so that it's about 90 degrees at your elbow when you're placing them on the desk. I often encourage people to sit close to the desk, so usually I prefer chairs without arms as well because they can hamper that closeness to the desk. The other thing I encourage people to do is probably put their keyboard out in front so they don't have to reach too far, okay? And also have the mouse or the phone or anything that they use within close reach. What I also advise people to do is also to try to have the monitor about arm's length in front of them, and to have the height of the monitor about eye level or a little bit below. Now, if you have these things in place, it does help with managing your posture a bit better. You can have the best workstation, the best chair in the world, but if you don't move, unfortunately you'll eventually get some discomfort in your back and neck. So oftentimes I encourage people to, if they can, get up every 20 to 30 minutes, move around, perhaps go and get a cup of coffee or go and talk to someone instead of emailing them. And if you're able to do this, combined with regular physical activity, that will help a lot in managing your pain as well.